It's now administered and supported by the AACN, which also supports CCRN, and the City of Hope and the National Cancer Institute. They support the curriculum of 8 different modules, including palliative care and nursing, pain management, symptom management, ethical issues, cultural considerations, communication, loss, grief, and bereavement, final hours, and achieving quality. I would like to read to you the key LNAC fact and philosophy. So this is really where we're coming from when we're encouraging our nurses to go to LNAC. So not just for med nurses, but all our nurses throughout the hospital. People in our country deny death, believing that medical science can cure any patient. Death often is seen as a failure of the healthcare system rather than a natural aspect of life. This belief affects all health professionals, including nurses. Despite their undisputed technical and interpersonal skills, professional nurses may not be completely comfortable with the specialized knowledge and skills needed to provide quality palliative care to patients. The LNAC project gives nurses the knowledge and skills required to provide this specialized care and to positively impact the lives of patients and families facing serious illness or the end of life. So that is LNAC, and all this material that we've come up with in the Palliative Care Committee is all based on LNAC. Comfort care. So what do we do here at Valley for comfort care? We start with our pain and symptom management order set. This is really important for continuity of care within all the floors, so that we're all understanding the same way that we do this. It's also important for intern learning. As a new nurse, you're going to have your first death. As a physician, you're going to have to go through having your first death. So they need guidance. Our interns, our residents need guidance on how to take care of these patients, and this is a very important key for that. Our comfort care policy is in our policy and procedures, and we have a handout, and this is included in, is the first page of the handout. Comfort care at the bedside. If you've been in nursing for more than, we'll say, 5-6 years, you've been through a few deaths, and this kind of is secondhand for you. If you're just starting, this is what you really need to know. And it's nice as an old hat to be reminded of these things. So we go over familiarizing yourself with our morphine drip, with our comfort care orders, knowing the parameter. We're not going to take vital signs anymore. So how are we going to titrate the morphine drip? It's going to be by pain. Is the patient in pain? Are they showing you that they're in pain? By respiratory rate sometimes, trying to keep it under 30. Trying to get a nurse to think out of the vital signs image is sometimes difficult, and kind of a lot of keeping the patient comfortable has been a lot of the education that we've needed to do with the 4 med nurses. Use of atropine drops, other medications. There's a whole realm of medications that you're going to need for shortness of breath, anxiety, nausea. Then making the family comfortable. So they try to get a private room. We try to make the room more comfortable by dimming the lights, whatever the family needs. We have donated from NITSPA, a knitting group, these homemade blankets to get away from our sterile white bed. It really kind of adds a nice touch at the end of life. So to any of our dying patients, you can find them on 4 med or TICU. We really need to get that social worker and the chaplain involved. We have 2 chaplains. They're 20 hours each, which makes full time, but we don't have them in the evening hours and we don't have them on the weekends. However, if they are available, they will be that listening presence for your family. It's not necessarily that they are a religious person, that they have a specific religion that they are attracted to, but our chaplains are trained to be just a listening presence and a support for them. And then we've got so many different cultures in our hospital. And the basic question, we might not be experts on all those cultures, but the basic question you can always ask is, how can I help with any end-of-life rituals that you might want Just start there and go with it. And at first they might go, oh, I don't know. But they'll come back to you. They'll start thinking about it and they'll come back to you. Yes?
There is a priest available 24 hours.
Yes, I'm sorry. Yes, and there is a priest available. And you can call the operator and they'll call him right in. Let's go back. The